following an emergency meeting held by the Ministry of Public Health last Wednesday to discuss a suicide prevention plan with stakeholders and ministries, it was found that the largest burden of suicide rests on Region 6, 3, and 4. While ministries and stakeholders are trying to brainstorm a remedy for the issue, PAHO WHO Country Representative Dr. William Adukro says there is still a lot of distance to cover.
We are really not doing too well. We are the worst in the world.
With the numerous organizations getting on board to fight suicide, he is commending the Ministry of Public Health for creating a method to avoid any clash of efforts.
The minister has really surprised me at this meeting. She just shared with me a mapping of all stakeholders. That's very good work done, because that was one of the issues I was going to raise. However, I think I see that the mapping has been done, but we need to also indicate which area of suicide these organizations are working in.
According to a report released by Chief Medical Officer Dr. Shamdir Prasad, family dysfunction, domestic violence, and a family history of suicide or previous suicide attempt are some of the risk factors which contribute to the high suicide rates in the country. To address these factors, Dr. Adukro is urging suicide prevention advocates to take their efforts to the community level.
There is the need for a cadre of staff that will look at the issue of community mental health. I think, and I must say that our clinicians are helping us a lot, but clinicians are clinicians because they have to be in the clinic, and sometimes we may not have the clinicians all the time. So we need to have some persons trained in community public health, and I'm hoping that PAHO we may be able to give fellowship, training in that respect, and it's something that I'm prepared to talk with them.
The Ministry of Public Health, other ministries, and stakeholders are guided by a 5-year National Suicide Prevention Plan. For HGP Nightly News, I'm Jessica Daw.